Okay. We're talking about the Affordable Patient Protection, Affordable Care Act, the resilience and stability of the Act. The individual states have power to refuse to participate in a Medicaid expansion by refusing to set up state exchanges. This was the part of the Supreme Court ruling that supported the lawsuit brought by the 26 state governments. However, this ruling by the Supreme Court is viewed as a temporary delay and will not prevent the Affordable Care Act from becoming fully operational. The law continues to be as unpopular today as when it was signed into law by the President. Approximately 55% of the population favored repeal of the ACA in March 2010. Now, I think that's significant. The law becomes the law of the land, and it's, at least 55% of the people do not favor it and favor its repeal as of the day that it's being signed. Today, approximately 52% of the population still favors repeal of the Affordable Care Act. Before the Affordable Care Act was signed, Bill Clinton predicted that the ACA approval will increase upon signature of the President. Of course, later Bill Clinton admitted that he was wrong with that statement. Okay, so the Affordable Care Act, the stability and its resilience, the initial stages of implementation of the ACA have been met with great controversy. And we all know about the contraception mandate. There are many religious institutions that have filed suit against the have filed suit in court to not have to participate with the ACA because of the contraception mandate. It's against their religious views. Many companies, many large companies, have decided not to participate with the ACA because of this particular mandate, the contraception mandate, because it does not follow their religious views. Hobby Lobby, a very large company in the United States, as of the first of the year, decided that they were not going to participate. They are being fined up to $1 million per day for not participating. And we still have to understand exactly what's going to happen with that. The controversial class, which was subsequently suspended in October 2011, dealt with home health care and assisted living for our senior citizens. And it was part of the original ACA, Affordable Care Act, but it was subsequently suspended. And we'll talk about that more coming up. Rising health care costs have threatened the Affordable Care Act. And we find that there's approximately 1,625 non-compliance waivers which have been provided by the White House. Now, these waivers mean that you are not going to be penalized because you are not in compliance with the Affordable Care Act. We find out that at least 50% of those waivers, those non-compliance waivers, are for the labor unions. The healthcare delivery system in the United States. Now, we're going to go back over the historical delivery system of healthcare in the United States. Give you a few points so you can understand where we came from and how we've gotten to where we are now with the Affordable Care Act. The healthcare delivery system in the United States is primarily a fee-for-service system. The majority of the industrial world provides socialized medicine to care for its citizens. With the addition of Medicare and Medicaid, the U.S. has become a mixture of socialized medicine and employer finance-based system. With the addition of Medicare and Medicaid, the United States, like we said, has become a mixture of socialized medicine and employer-based, finance-based system. The employer-based system has its beginning in Germany in the 1870s during the Otto von Bismarck rule. It's interesting that the employer-based system took hold here in the United States during World War II. Everybody remembers the women. The women going to work to help the war effort. They were given health care as part of a employer-based benefits to attract them to come in and do work for the war effort. Kaiser Permanente was a leader in the providing health care insurance for its employees. So basically, to be competitive in hiring the most qualified personnel, the system of offering tax-free benefits to employees has continued in the post-World War II years. A major observation is the free employer-based health care insurance system encourages overuse of health care. Now, I think that's an interesting point. Many people feel like the healthcare system is overused. If you get a sniffle, you go see the doctor. The doctor prescribes you some medication, and that solves your problem. But it is a major observation that this because the benefit is free and it doesn't cost the people anything. They overuse the system. They go to the ER, they go to the hospital, they go get prescription filled. The system is just basically overused because of what experts call the employer-based system. So many experts have recommended the taxation of employee health care benefits. They feel like the taxation of the employee health care benefits will drive down the use of the overuse of the health care system. Incidentally, the tax-free benefits have long been the subject of inequities with self-employed individuals. Corporation employees get the benefit free, the health care benefits free. The employer, typically the large corporations or medium-sized corporations, get a tax deduction for the health care benefit. Self-employed individuals have traditionally had an inequity involved in the tax-free benefits of health care. Okay, I think it's this gets down to the meat of the Affordable Care Act. Now, what we're going to do is we're going to analyze who is being insured and who's not being insured. Okay, Americans who enjoy health care insurance benefits. 48% of Americans receive health care insurance through employer-based insurance plans. Again, that's a non-taxable benefit to the employee. It's a tax deduction to the employer. And 48%, and experts estimate 48% of Americans receive health insurance through these type of insurance plans. 28% of the population receives health care through government financial assistance. This is typically 15% through Medicare and 13% through Medicaid. 24% are uninsured or have personal insurance. Now, this is the group that ACA is targeted to help. The 24% 1 in 4 Americans is what ACA is trying to work to. That's what the American Affordable Care. That's what the Patient Protection and Affordable Care Act is targeted towards. So ACA is targeted to help 24% of Americans who have personal insurance or do not have health care insurance. Of the 24%, 9% presently purchase personal insurance. Now these are people who typically are unemployed or under 65 and are not covered by Medicare, and they have to purchase their own insurance. The problem with that is significantly higher than typical insurance premium. The premiums are significantly higher than typical insurance premiums, and many people cannot afford that. So they fall into 15% uninsured. Now, the 15% uninsured are typically, that represents about 50 million Americans, that 15% class. Now, 13 million of those are illegal aliens. The remaining 13 of 50 is roughly 26%, or 1/4 of it. The other 3/4 of that 15%, or roughly 11.5%, are young adults, people under 65 with low income, and others who represent the remaining 37 million Americans. Now, this is the target group that we want to that the ACA wants to deal with. Now, young adults, we remember when we were 20, 21, 22, we didn't need insurance. We were low risk, we were healthy, but ACA is going to require these people through the individual mandate to have insurance. That spreads the risk, it helps finance the total ACA program. People under 65 with low income and others are people who cannot get insurance because they got a pre-existing condition, or they do not qualify for other reasons, and they can't afford it, basically. So ACA experts forecast that by 2020, 95% of Americans will be insured. Now this is an 11% increase over the present 84% who are not insured. So again, we're looking at 11% of the nation is what? Making sure that 11% of the population of America is what we're trying to get insured through the Patient Protection and Affordable Care Act. The uninsured people will still have access to health care, but they'll receive health care from an ER, a hospital emergency room, or community health center. Basically, there's a federal law that says if I walk into whoever I am, including an illegal alien, if I walk into a ER, they must give me health care and take care of whatever my problem is. So those people are still going to be able to, whoever is still uninsured will be able to get health care benefits, or have health care, basically have access to health care. So right now, what we're going to do is we're going to talk about the impact on the American Care, the Affordable Care Act, impact on different groups, the good news and the bad news to each group. Medicare recipients, good news. The good news to the Medicare recipients is that the Affordable Care Act helps close the donut hole in Medicare Part D. Now, without going into all the particular facts and figures of what Medicare Part D is, but Medicare Part D basically pays for prescription drugs for seniors. ignoring the deductibles and the co-payments actually the deductibles and the co-payments is referred to as a donut hole. That's the money that the senior citizen must pay in order to participate in Medicare Part D and get the prescription drugs. Obviously, this can amount to a considerable amount of money. The Affordable Care Act, beginning in 2014, will phase out that donut hole so that by 2020, Medicare Part D will be 100% subsidized by the federal government. Now, this is the only thing that Affordable Care Act does for senior citizens, is that donut hole. It is closing that donut hole, and they don't close it right away. They start in 2014 and they phase it out over between 2014 and 2020. The bad news for Medicare recipients is Medicare will pay $719 billion to help finance the Affordable Care Act. And this losing $719 billion to finance the Affordable Care Act is expected to result in a reduction in Medicare benefits and Medicare Advantage program. Even though the President and Congress says it won't happen, you can reasonably expect that this is going to affect the Medicare benefits that senior citizens will receive in the near future. So, the good news and the bad news about employer-based insurance. The good news is there are new rules and regulations which improve many benefits, including co-payments and deductibles. Also, there will be no annual or lifetime limits. There will be no provision for pre-existing conditions. Small businesses will benefit from insurance exchanges and business tax credits. The bad news is small employers with that may have high-cost insurance may opt to cancel their insurance and pay a $2,000 fine per employee. Many experts estimate that 10% to 30% of small businesses will adopt this strategy. Obviously, they expect premiums and deductibles to continue to rise because of additional costs to insurance companies to operate these plans. So, personal health insurance. The Affordable Care Act, insurance exchanges should be more affordable due to government subsidies and better protection comparable to employee-based plans. So that's going to, obviously, that's a benefit for personal health insurance recipients. Remember, they represent 9% of the 9% of that total group. These are people who are probably unemployed, less than 65, do not qualify for Medicare, have a pre-existing condition, or some kind of limitation that will not allow them to have insurance. And they have to go out and spend a significant amount of money to secure insurance. As healthcare costs increase, insurance copay deductibles and premiums will increase. So again, that's on the rise, and that's a negative for people who have personal insurance. But their ability to go to the insurance exchange, if they do qualify, will minimize the amount of money that they will have to pay. The uninsured. Now, these people will benefit the most from this. The uninsured will have access to government-subsidized insurance exchanges. Those individuals that do not qualify for government subsidies will experience more costly insurance. Now, remember that the poverty level benchmark in 2010 was approximately $29,500. That meant for a single person to qualify for the insurance exchange or Medicaid, he or she had to make less than 133% of that $29,500, which is approximately $40,000. 400% of $29,500 is approximately $120,000. So I mean that covers a pretty good group of people, a pretty large group of people. The young and healthy Americans that traditionally do not purchase insurance will be required to purchase insurance in accordance with the individual mandate. Now, these people typically did not buy insurance. They were young and they were healthy. They're low risk, but again, having them pay for this spreads the risk from an insurance point of view, and they will help finance the total population in the Affordable Care Act. The Medicaid in CHIPS. The good news is increased Medicaid coverage and increased primary doctors. The bad news is estimated an additional 15 million Medicaid enrollees in state exchanges and eligibility requirements. So obviously there's going to be an influx of more people going after health care. They're going to be put into the system, the delivery system, and it's going to be overworked. Okay, so the President and Congress assure senior citizens the quality of care will not be impeded. However, there's no guarantee that this will not happen. The intention of the program will be to continually monitor and control costs in the future. However, again, with the strong influx of people coming into the system and getting free medical help, if doctors, hospitals, and other health care providers are negatively impacted by Medicare or Medicaid procedures and reimbursements, they may refuse to see Medicare or Medicaid patients. Gym memberships and vision care may disappear from Medicare Advantage plans. Part of the Affordable Care Act is the implementation of the Independent Payment Advisory Board, IPAB. The IPAB is a new presidential commission appointed and not elected. They will be given considerable power to cut Medicare spending. So this is a group of people who are going to be appointed by the president, and they're going to come in and they're going to make decisions about Medicare spending and Medicare procedures. Their decision will be automatic and absolute, and not be subject to being overruled except by a supermajority, 3/5 vote in the U.S. Senate. The IPAB will in effect give political protection and shield the President and Congress from criticism. And they built this into the Affordable Care Act. And then finally, the Accountable Care Organization and other bundle payment programs. These are very similar to the HMOs that we experienced in the mid-90s. And remember, HMOs, they had managed care people who decided on what price, whether they approved the procedure that was to be performed on or suggested by doctors or surgeons, and they also determined the amount that was to be reimbursed. Again, we're back into that bundle payment program with the Accountable Care Organization. This entire program is on our website, ntlf.org. That's North Texas Assisted Living Foundation, intital.org. You can go to our website and see a copy of this film, or read a narrative of this presentation. This is the first in a continuing series. We estimate that there'll be up to 6 different programs about Affordable Care Act. This is just the beginning, and we would welcome you to come back and or check out our website and take a look at this information. We have on our website a ACA timetable implementation dates, and talks about the dates that the particulars are to be implemented by. And I think that this is useful information, and you're welcome to go to our website and take a look at that. Also, I think that this is interesting. We have a Facebook page. We would welcome anybody to go to North Texas Facebook, North Texas Assisted Living Foundation, and read the information that we have on our Facebook page. We have good, strong information that is available to anybody to review. 2 particular items that are of interest in conjunction to this program is this map of essential health benefit benchmark plan selections, December 2012. On let me see, mid-December, all the states in the country had to say if they were going to participate with the state exchange or not, not participate. These white states here, these states in white have decided not to participate. There are 24 of them. The rest of these states are in some HMO plan, or they're going to participate in a state, their own. They're going to implement their own state exchange, or they're going to go with another group of states to basically have a small state exchange co-op. I would think would be the best part of it. This is good information. You may want to take a look at it. It's a part of, it comes from Kaiser Family Foundation. You can find it on our Facebook page. Another item here deals with benefits, who benefits from Affordable Care Act expansion. I'm about ready to run out of time. I appreciate everybody coming in. Please take a look at our information. We welcome you to come back next month. Thank you so much, and we appreciate your support. Thank you.